What's the first thing that comes to mind when you hear the term type 2 diabetes? Perhaps you're picturing a life without sweets or a disease only for the overweight. But are these perceptions accurate? In our society, misconceptions about type 2 diabetes are widespread. They often lead to misunderstandings and can even hinder proper care. Today, we're going to cut through the noise and debunk some of these common myths. Ready to debunk some myths? Let's dive in. Myth 1. Type 2 diabetes is a mild form of diabetes. What's the reality? Well, let's get this straight. There's nothing mild about type 2 diabetes. It's a serious chronic condition that impacts how your body regulates glucose or sugar in your bloodstream. If not properly managed, it can lead to a host of complications. We're talking about heart disease, which can lead to heart attack or stroke. We're talking about kidney failure, which might require dialysis or even a kidney transplant. And we're talking about blindness, a result of diabetic retinopathy. So let's not underestimate type 2 diabetes. That's myth 1 busted. Type 2 diabetes is not mild. It's a serious condition that requires careful management. Myth 2. People with type 2 diabetes cannot eat sugar. Is that so? Let's clear the air on this one. It's a common misbelief that individuals with type 2 diabetes must absolutely avoid sugar. This isn't entirely true. While it's vital to monitor sugar intake, it doesn't equate to a strict no-sugar diet. Understanding the role of a balanced diet is crucial here. It's not just about sugar, but the overall intake of carbohydrates, which can significantly impact blood sugar levels. So it's more about smart choices and portion control rather than complete avoidance. So, myth 2 has been debunked. People with type 2 diabetes can have sugar, but like everyone else, they should consume it in moderation. Myth 3. Type 2 diabetes is only for overweight individuals. Is that the case? Well, not exactly. While carrying extra weight, particularly around the belly, can increase your risk of developing type 2 diabetes, it's not the only factor at play. You see, this condition can develop in people of all shapes and sizes. In fact, other risk factors like family history, age, and ethnicity can also significantly contribute to the onset of type 2 diabetes. For instance, if you have a close relative with type 2 diabetes, or if you're above 45 years old, or even if you belong to certain ethnic groups, your risk may be higher. So it's crucial to remember that type 2 diabetes isn't a selective condition. And that's myth 3 busted. Type 2 diabetes is not exclusive to overweight individuals. Now let's do a quick recap of the myths and facts we've discussed. First, we busted the myth that type 2 diabetes is a mild form of diabetes. It's not. It's a serious condition that requires active management to prevent complications. Then, we debunked the misconception that people with type 2 diabetes must avoid all sugar. While it's crucial to monitor sugar intake, it doesn't mean a complete ban on sugar. Balance and moderation are key. Finally, we shattered the stereotype that type 2 diabetes only affects overweight individuals. Weight is a risk factor, yes, but it's not the only one. People of all shapes and sizes can be affected by this condition. Understanding these realities is crucial. We must dispel these myths to effectively manage and prevent type 2 diabetes. It's not about scaring people, it's about equipping them with the right knowledge. Remember, diabetes isn't a death sentence. It's a condition that requires adjustments to one's lifestyle. And with the right knowledge, those adjustments become manageable, even empowering. So let's continue to learn, to question, and to understand. Because when it comes to type 2 diabetes, misinformation can be as damaging as the disease itself. Remember, knowledge is power. The more we know about type 2 diabetes, the better we can manage it and prevent its onset. Please like and subscribe, my friends, if you find value in our videos, so we can grow and help people with their path to a healthier life. Thank you.